Okay, so hyperhidrosis. Your FY2 in GP, your patient is 17, has made an appointment because your patient has got excessive sweating. Talk to the patient, assess and address her concern. Hyperhidrosis. So patient has made an appointment. Sometimes they will just tell you in the question that your patient has got some concern. Go and talk to her, assess her, and address her concern. So you may not have the presenting complaint in the question. All right. Now, how can I help you? Doctor, I feel embarrassed. Sometimes they don't open up straight away. I feel embarrassed. So you just have to tell them it's a safe place. Tell me what's happening, what is making you embarrassed. I'm here to help you. And if you tell me what's happening, I'll try my best to help you in every possible way. Okay. Then patient is saying, I'm sweating a lot and recently it's getting worse. I'm sweating a lot and it's getting worse. Okay, tell me a bit more. So what do you want to know? So for how long you've been having it? So it's going to be, doctor, many years. It's been 2 years. Then I'll do quick OD para, right? So if you have pain, you do Socrates. If you have got other problems, we go for OD para, right? So ask like if it is getting worse, is there anything that makes it worse? Is there anything that makes it better? Doctor, stress and heat makes it worse. Okay, that's fine. And where exactly do you get the sweating? That is really important as well. So patient is saying like it's in the palms or underarms. So that's really important as well. Now, hyperhidrosis, having a bit of sweating in the palms and underarm, it's not something abnormal, isn't it? It's normal. You'll see in a lot of patients, a lot of people actually, including us, we may have it. So there is nothing much to worry if it is primary hydrosis, hyperhidrosis. But the thing is, in these kinds of scenario, what they are looking for, are we trying to rule out the secondary causes of it or not? For example, you have a scenario of Raynaud's as well. So Raynaud's, mostly it's primary Raynaud's phenomenon, right? But what in the exam, what they're looking for, are you ruling out the causes of secondaries or not, like secondary Raynaud's phenomenon? Same here, hyperhidrosis, mostly it's primary. Primary means there is no cause behind it. But still, you need to rule out if there is any underlying cause or not. So hyperhidrosis, excessive sweating, you can have if you have got fever, if you have got TB, for example, you get sweats, night sweats and all. So you have to ask if there is any fever, night sweats or not. Cancer, what you have, you can have all these things as well in cancer as well, right? So that's why you need to rule out these things. Thyroid, if you are having thyroid problem, then again, you can have all those things. And your patient is female as well. So it even make more sense for us to ask about these things. Okay. Okay, so before we go into further into this, what are the risk factors actually? So risk factor for hyperhidrosis, number one, it actually runs in the family. There's a familial history, that's really important. Often starts in adolescent age, right? Associate condition, it is usually associated with the stress and anxiety. Some patient you will see because of obesity or hyperthyroidism, they might have. Some patient, they are using some medications, certain medication like antidepressants that can make it worse as well. So that is what you need to do in the history, right? Diagnose primary focal hyperhidrosis when focal, visible, and excessive sweating occurs at least one of the following site: axilla, palm, soles, or craniofacial region. And it lasts for at least 6 months and has got no apparent cause. Because if there is an apparent cause, it is not primary hyperhidrosis, right? And it has to last at least for 6 months if it is in axilla or palm. So if you see our patient, what our patient is saying, she's saying, I've got the sweating, excessive sweating in my palms and the axillary area, and it is there for last 2 years, right? And has at least two of the following characteristics. It's bilateral and relatively symmetrical, because if it is unilateral, it can have some secondary reason behind it. If it is impairing your daily activities and frequencies of at least one episode per week, onset before 25 years of age, positive family history, and cessation of local sweating during sleep. So when you are sleeping, you don't have any problem. But when you are awake, you have the problem. So it means it's primary. I mean, there is no other cause behind it. Because if there is something like, say, TB or cancer, even if you're sleeping, you will have the sweating, isn't it? So that is the main thing. So our patient definitely, what you need to do is you do OD-para. When you do proper OD-para, what you will see that it is primary, but you still try asking some questions if there is any fever, any night sweats, any weight loss maybe, any loss of appetite, any tremors, any eating more than usual for thyroid and all. So this is something that you can ask, right? And try ruling out some risk factors as well, if the patient is stressed or not recently, right? Or family history of anything or not. So that is something that you need to cover. Then I would like to do general physical, vitals, and obviously you'll check the affected area. And I would like to check your full blood count. You can check for thyroid. You can check for HbA1c as well. Okay. And then we can say like you have got hyperhidrosis, and this is like something, this is like you're sweating more than usual, can affect your hands, your axillary area, and sometimes our facial area as well. So what is the management? Management is nothing much. Management is lifestyle changes. So what is the main reason this patient is telling? Stress and heat. So work on the stress management, yoga, meditation, and work on the heat. So don't go in the heat, maybe cover yourself and all that would be much better. All right. So practice stress management techniques, relaxation exercises and all. Wear loose, breathable clothing, avoid hot and spicy food that might increase sweating, right? And usually topical treatment, we advise the patient to go with this aluminum chloride. So that is something that you can get. Some general advices that you can give: keep the affected areas clean and dry, because if it is not clean and dry, what can happen? If it is like sweating all the time, and if you're not keeping it dry or clean, it can actually lead to some skin infections as well. So you have to be very careful of that. Use anti sprays, I mean the deodorants, antiperspirants that are for excessive sweating. Consider using absorbent material like sweating pads or clothing liners. Maintain a healthy weight and regular exercise routine to manage your symptoms, right? There are further management plans as well. To be honest, if you mention this much, that's more than enough. You don't need to go into too much of detailing. However, treatment options are, there are oral medications as well to block the sweat glands. Botox injection can be given underarm for the sweating, and some like surgeries, ETS, and all that can be done. But I would say it is too much. You don't need to go into that. Mainly, you need to work on the lifestyle. You need to work on the stress. You need to work on the heat, for example, and your food, what you're eating, and maybe we can give you aluminum chloride. That is the main thing, right? And for these advanced treatment and all, if you have to go with, definitely it's not gonna given to you by the GP. We maybe refer you to the specialist as well. Is it lifelong? It can be a long-term condition, but we can manage or reduce the symptoms, and you will see over time it can improve. Why do I have it? The cause is often unknown, but maybe genetic, right? So sometime when we are doing this excessive, when we are having this excessive sweating, there might be a reason behind it. But I have taken your history. There is nothing sinister that I could find. So it can happen without any reason as well, and it can get worse when a person is having stress, when the person is having anxiety, when person is obese, when person is, having any of these things, right? So that is what we need to cover in this scenario. So that's your primary hyperhidrosis. Please try to find out if there is any reason behind it or not. That is really important. All right.